not saying that, the basic facilities, like, they have extreme modern facilities, but the basic amenities are present there. Okay? And the basic amenities, earlier it was the case that the basic amenities were far off, but now it's not the case. The basic amenities in terms of healthcare are not far off. Okay? They're very near to the people. It is mainly awareness issue. Socioeconomic divide, we all know that different background people from a lower economic background, often struggle to afford quality healthcare. Take care. And they're unaware of their health rights and available services. But the government is doing everything in their power to make them aware, aware of their health services. Take care. Health insurance, the penetration of health insurance is low. ठीक है, which is mainly a problem of affordability. Many Indians pay out of the pocket for healthcare, leading to financial hardship. ठीक है. Now, if we talk about infrastructure and resources, so you would see that there is inadequate infrastructure. ठीक है. There is a shortage of healthcare professional. One of the main reason why healthcare professional shortage we are facing is, it's not actually because we have less medical colleges or we do not have the infrastructure. It's actually because our population is growing at such a horrendous rate. It's growing so fastly. It's growing so fast that we are not able, our physical, intellectual infrastructure is not able to keep the pace up with it. So that's the main reason for shortage of healthcare professionals. Okay. Distribution of resources. Of course, the distribution of resources is uneven. It is concentrated mainly in urban area, leaving the rural and remote areas, regions less, with less resources. Okay. Now, if we talk about quality of care, okay, you see that there is a variability in quality. There is a need for standardization. Okay. We require patient safety and satisfaction. Okay. So if we see, if we're going to study government initiative, we're going to do analysis of Ayushman Bharat and impact on healthcare accessibility. Okay. We're going to see regulatory, we're going to see evaluation of drug approval process, we're going to see medical practices, hospital accreditation standards, and in technology integration, we're going to see growth of telemedicine, health, digital health, and innovation in medical technologies and pharmaceutical. So when we talk about policy reform in healthcare sector, see, reform in healthcare sector. See, policy reform landscape in India healthcare sector plays a pivotal role. Pivotal means it plays an important role in shaping the functionality and accessibility. So, when you talk about healthcare, it should be accessible to all and it should be actually useful. That's what we mean by functionality. So, understand this. For example, if there is a disease called X, ठीक है, which is not prevalent in India, and India is creating cure for disease X. It is of no functional use to India. Whatever is actually, is a major problem to the country India, take care, we have to address to that issue. That is why whenever we make any policy, we're actually addressing to the problems which are very, geographically linked to us rather than thinking at a global level. We also think at a global level, when we have to create an positive impact for the overall society, because India now believes in that we're global citizens, so we have a global, you know, initiative to take part in also. We have to play part in the global chain and creating a global environment. Yes. So the reform addressed various aspects of the sector from infrastructure development to insurance scheme. So when you talk about healthcare sector, okay, the reforms are from infrastructure development to insurance schemes. ठीक है, ठीक है. And of course, the main reason for such reforms was ठीक है, reason inclusivity. So it is inclusive to everyone. Accessibility and efficient healthcare system. Okay. So the key policy initiative are number one, national health policy. National health policy talks about its objective are focus on increasing health expenditure, ठीक है, emphasizing preventive health care and aiming to provide universal health coverage. So when you talk about sorry guys, one minute. You talk about national health policy. National health policy with it's going with the objective of increasing health expenditure, take care, emphasizing preventive health care and aiming to provide universal health coverage. Then you have Ayushman Bharat. Ayushman Bharat is one of the largest government funded health insurance schemes designed to provide free health coverage at secondary and tertiary levels to the underprivileged and vulnerable groups, or what you call marginalized groups. ठीक है. प्रधानमंत्री जन आरोग्य योजना, accessing the impact of Pradhan Mantri Jan Arogya Yojana a component of Ayushman Bharat on improving healthcare access to over 500 million beneficiaries. Yes, that's right. You heard 500 million beneficiaries. Now, see, reforms can again be divided into two forms. These are the key initiatives. Then you have something called regulatory reforms, where you put policy reforms on the institute which are working. So, number one is Medical Council of India reform, discussing the reforms in the Medical Council of India, which include efforts to standardize medical education and practice across the country. Then you have drug and clinical trial regulation, where you have to evaluate reforms of drug regulation and clinical trials to streamline the approval process while ensuring safety and efficacy. Then you have drug approval and standardization. You have to evaluate the process for drug approval and maintain the medical standards. Take care. Last not the least, you have medical practice and hospital accreditations. Take care. Where you're trying to understand, are the you know universal accreditation standards being followed in the hospital and healthcare facility. ठीक है. Then the government is actually doing a lot of spending on infrastructure development. Infrastructure development has two key points. Government is improving, upgrading health infrastructure. ठीक है. ठीक है. So government is grading health infrastructure. ठीक है. And then government is aiming for triple P, which is public private partnership. ठीक है. Then government is doing reforms in health information management. ठीक है. When you talk about health information management, you talks about digital health initiative and health data governance. Okay. When you talk about technology integration in healthcare sector, ठीक है, you talk about we are talking about technological integration in healthcare sector. ठीक है. So we'll talk about digital health platforms. ठीक है. Then we'll talk about we talked about mobile health और M health. ठीक है. Then we talked about AI, artificial intelligence, and machine learning. Then we talked about wearable technology and IoT, Internet of Things. If we talk about digital health platforms, the two things which was a remarkable work done by government were one was telemedicine, which happened during COVID-19 pandemic. Son, and the other two, telemedicine, and now you have e-health records. Okay, so you have electronic health record. Every hospital is required to maintain electronic health records. Okay, even private clinics are required to do that. Okay, in mobile health you have mobile health applications. Okay, and at the same time the government is trying to do an outreach program to create awareness and spread education among people. Outreach and education. Okay, when you talk about artificial intelligence you have diagnostic and treatment tool, and on the other thing you have internet of medical things. You have IOMT. So integration of internet of things in healthcare, improving patient experience and enabling them efficient hospital management and operations. That is what you mean by internet of medical things. Again, internet of medical things means where you're integrating IoT, you're integrating IoT with healthcare. ठीक है, with the aim of improving patient experience. The pen ultimate goal is to improve patient experience. ठीक है, and that will result in enabling efficient hospital management and operation. ठीक है, so the aim result is to have efficient hospital management around there. ठीक है, then you have something for wearable devices. You have health monitoring devices like your Apple Watch and any other watch which is actually telling your SpO2 level or blood pressure. Health monitoring devices, you have something called that. Okay. And under the category of AI, okay, you would actually also put research and drug development. Now, when you talk about technological integration in healthcare sector, it does face some challenges. And these challenges are accessibility and digital divide. Number two, data privacy. See, data privacy and security is such a big issue that the government has said when they brought in the new policy where you're supposed to keep those digital records, that no data, okay, which is such personalized data, A, would be accessible to anyone other than the party which is to whom the data belongs to. If it's confidential data, the doctor cannot share it with anyone else, and no company, whosoever is collecting this data, can share this data with any person. If they are, found guilty of doing such a thing where they're stealing the data or selling the data to anyone, then a legal action would be taken against them. Second very big judgment is that you cannot keep such the crucial and sensitive data outside India. If you are keeping it in a server, you cannot keep it in a server which is situated outside India. It has to be a server which is situated inside the boundaries of India. Okay. And number third is sustainable implementation. Okay. So you require sustainable implementation. Okay. Now we are done with the, healthcare sector. We'll actually go for strategic evaluation of the education sector. Strategic evaluation of education sector. Okay. When we say, in the context of education sector in India, the current state and challenges part of this framework is a very big challenging is a challenging state because see, education in India or any part of the world to promote economic growth is been a very important part because we have been speaking about how education creates a well-informed citizen, which will of course create an healthy citizen. So it's a chain, right? So if we want to directly influence a country's competencies, economic growth, take care, we have to create a workforce which is ready for every change, which is, flexible. We require a quality workforce. For that, we require high standards of education. We require a good infrastructure which can support this high standard of education. Okay. So a key point which here we will make is that if we want quality of workforce, and this quality is defined by they are well informed. We are assuming they're healthy. Okay, we are making that assumption that they are healthy. We just require a well informed workforce. Then one of the key driver would be that we spend a lot, you know, on we create high standards of education. Okay, we invest in infrastructure. Number third, we have high on resource allocation. ठीक है. So despite the one of the biggest challenges that we have a high enrollment rate, take Indian education system, you know the major challenges which we are facing is in maintaining quality of education, especially at the foundation level, right? So we want to, our penultimate goal is to create and nurture good human capital. We want to create good human capital and which we are able to integrate with the skill required in the global job market. So we're able to increase this human capital with the skill available, and we're able to transform it into high level of job, into high jobs, more employment, right? So one of the key factors, which one of the things we are going to discuss first is quality and standards of education. We talk about quality and standard of education. Now, when we are taking this debate of quality and standard of education, okay, so one key debate would be what is the difference between enrollment versus quality, okay. Second, which we which would again come, okay, curriculum and teaching method, teacher training, how you're developing your faculty, and performance. How are you evaluating the performance? Like, is it a 360-degree review where all the stakeholders are able to tell whether that particular person who's in charge of teaching did a good job or not? Okay. After your review, when you have incorporated all the performance, the next step which lies is in the assessment system. Okay. Assessment means whatever you taught the kid, how are you going to assess that whether the kid was able to learn it within the span of time or not? Okay. They're able to apply their knowledge in the real world situation or not. When we talk about, after talking about quality and standard of education, the other area of interest or other area which requires discussion is infrastructure and resources. Okay. So when you talk about infrastructure and resources, the main points which should come to your head are classroom infrastructure, ठीक है, access to learning materials, ठीक है. And if you say that we are going to decrease this by, we जैसे during COVID-19 we see in the pandemic that kids were not able to physically go to the school, so we said that we can have online classes. So there would be something called a digital divide. The kids were able to go to the online class, and the kids were not able to afford to go to this online classes also. So we need to talk about this. In this thing, further, if you actually talk, you need to talk about, you know, whatever you have taught. Okay, skill men and employability. So we would see that there is a mismatch. There's a mismatch with industry requirements. Second, we require to focus on vocational training and technical education is insufficient in addressing the needs of India's rapidly changing job market. That's why you will see a lot of vocational trained technical education courses are coming up. Vocational training and technical education. ठीक है. We also require to impart life skills and an holistic development. ठीक है. And we need to focus more on higher education and research. So when you talk about policy reform in education sector, you should be talking about the National Education Policy 2020. Okay. The National Education Policy 2020 was a landmark reform with a strategic objective aimed in overhauling the Indian education system. It emphasized in holistic, flexible, and multidisciplinary action aiming to equip students with the 21st century skills. The impact of NEP 2020 potentially impact is profound. You when you revamp the curriculum and pedagogy, which reduces the content load and make learning more student centric. So the object was to make learning more student centric. The policy is so poised to create a more dynamic, responsive, and inclusive education system. What are the implementation challenges of the NEP? Successful implementation of NEP 2020 requires a strategic approach considering resource allocation, teacher training, infrastructure upgrades, and execution of this policy at various education levels. Regulatory environment. So the role of, if you say regulatory environment, you have to see the role of regulatory bodies. Okay? Bodies like UGC, All India Council for Technical Education, AICTE, National Council of Education Research and Training, NCRT, plays a critical role in shaping the education landscape. Strategic educate assessment. Okay, we have to assess whether we were able to implement NEP 2020 and what are the role it is playing in implementing educational standards and promoting innovation. Now, if you see technical integration in the education sector, okay, so we would see e-learning and digital platform, rise of digital education. Take a you see that these methods are very effective. They're delivering quality of education. They're addressing the digital divide and they're ensuring the equitable access to all the students. Take a in innovation and education, we will see that emerging education practices where there are classrooms where you would see their where you would see their classrooms where artificial intelligence and machine learning teaching method represent a strategic shift in education practices, and these policies are being implemented. Now we would talk about public private provision. Take a strategy perspective. Here we will actually talk about role and scope. So we have already talked about universal access and equity. We have talked about provision of basic services. We have talked about strategic importance. Okay. And when you talk about funding and resource allocation, you have already talked about government funding, how resource allocation budgeting should be done, what should be the priority setting, challenges and limitation to all of these services are: a, bureaucratic inefficiencies; b, we have limited resources; c, quality of service, right? And d, you require strategic focus on improvement. So the whole process should be very flexible. We need to enhance our accountability. We need to build up mechanism where we could work on the quality of services, okay, which includes investing in workforce training, upgrading infrastructure, implementing modern management practices. So that is all from my side.